Welcome. This is Knowledge for Wellness TV, and we focus on health issues, preventative health measures, and alternative therapies. We know you are hungry for this type of information and want to give you what you want in a fast, friendly, efficient, and educational way. Today we're discussing ovarian cancer, and we want you to have knowledge to help make an informed decision. So, Kristine, would you please tell us a little bit about ovarian cancer?
Certainly. Ovarian cancer is a condition when you have malignancy in the ovaries. And the ovaries are two small almond-shaped organs located on each side of the uterus. So that's basically what ovarian cancer is.
Wow. And it seems as if this cancer itself is very hard to detect.
It's very hard to detect. It's a cancer that is very subtle. The symptoms are vague. They are symptoms that women have often, such as bloating, back pain, maybe a little abdominal discomfort, fatigue, urinary issues. They're things that we could easily dismiss, or a doctor could easily dismiss for other conditions.
Yes. And I understand that once you've been diagnosed, you have to go and see a specific doctor as well.
Yes, exactly. I was diagnosed at stage 3, and I immediately went to a gynecologic oncologist. This is a very important specialty for ovarian cancer.
Sure.
Those type of oncologists know exactly how to treat ovarian cancer, which is a very, very deadly cancer.
Wow. And so when you do feel this, you mentioned not to dismiss it, but yet you don't want to go to your doctor and kind of cry about something that is very common in a lot of women.
Right. I tell women, if you have any of those symptoms that I suggested, or excuse me, that I mentioned, and they persist for more than 2 weeks, you need to go to your doctor and you need to voice your concerns.
Right.
So basically, for me, I say the guideline is about 2 weeks, because maybe you have had a bug and that lasts for a week, but 2 weeks or longer is a concern.
Yes. So we're here to educate the viewers on ovarian cancers with not only the signs, but to be privy to yourself and to take care of yourself as well.
Absolutely.
Yes. And also, when you do have this, you have a support group as well.
Absolutely. We have a foundation called Charlene's Light, a nonprofit foundation for ovarian cancer. And I created this foundation in 2008 in honor and memory of a dear friend, Charlene Postigo, who passed away from ovarian cancer.
Wow,
and
so
we
sad.
both really wanted to do something together. And so near her dying days, I told her that I was going to start this foundation, and we talked about how we could educate women and the community about ovarian cancer symptoms, since they are very, just not a lot of information out there about ovarian cancer. So we have the foundation, and we provide support and hope to patients and families.
Yes. And also to have someone that they can go to that has gone through this as well. So tell us a little bit about the foundation and Charlene's Light.
Certainly. Well, the mission of Charlene's Light is to educate the women and the public about ovarian cancer symptoms, to raise research dollars for, very much needed research, and to also provide support and hope to patients and families, because, going through cancer is a very difficult ordeal, not just on the patient, but on the family as well. So we're there to help.
Nice. And you also help people come out of what they need to in the depression, and you offer that type of support as well.
We have resources. We can direct women to different organizations. If we hear of somebody diagnosed with ovarian cancer, we send flowers to them at their home, just to let them know that someone is thinking of them, and that we're out there. We're out there, and we're a great resource for women.
Yeah, and they don't have to go it alone.
No, they don't. They don't have to go it alone. It's a very scary cancer.
Yes. And you talked about the diagnosis, it being, hopefully they can catch it in stage 1, but majority of the women don't get diagnosed until they're in stage 3 or stage 4.
Exactly, and the later the diagnosis, the odds just are not very good.
No.
And women are diagnosed at a late stage because these symptoms are so subtle. They are not silent, they do whisper, but like I said, they're things we easily dismiss. So by the time these symptoms are really obvious, it's often progressed beyond just the ovary into the pelvic area or the abdomen.
Yeah. So again, would you please just tell the little symptoms that are...
Certainly. Most women I've heard say they've had some bloating, some back pain, pain in the pelvic area or the abdomen, frequency of urination, fatigue. And for me, at stage 3, I had no symptoms.
Oh my.
So looking back, I can say, I think I was getting up once a night to go to the bathroom. It was summer. I was drinking a lot of water. I dismissed it.
Yes.
So I just went for an annual exam. So basically, you know, those symptoms are so subtle. That's rather concerning and very scary.
Yes. And also, we've been told that a pap smear does not detect ovarian cancer as well.
No, and I've heard many women say, well, I had a pap test, I'm fine. No, that does not detect ovarian cancer.
No.
Ovarian cancer has no early detection test, and at Charlene's Light, we want to change that. We want to raise research dollars. There is research out there, but we need more.
Yes.
We need an early detection test.
Very much so. Well, appreciate you educating my viewers.
Well, thank you very much for having me.
It's been a delight.
Thank you.
What a great day for knowledge and learning how to benefit yourself and your loved ones and educating others. So take care.